I'm Dr. Maggie Kirkman. I'm a Senior Research Fellow at the JHRU Research Unit in the School of Public Health and Preventive Medicine at Monash University. The JHRU Research Unit is an innovative partnership between Monash University and JHRU for Women's Health. We're based at Monash, but we really benefit from our partnership with JHRU for Women's Health. JHRU for Women's Health is a clinic and also a community education centre, so that our research is translated through JHRU for Women's Health and distributed throughout the community to doctors and to lay people all around Australia and increasingly internationally. The JHRU Research Unit itself conducts psychosocial research. We're particularly interested in women's health, but women live in the community, so we also research men and children. The psychosocial component arises from the social model of health that we understand and adopt. So we don't see individuals in isolation being healthy or being ill. We look at how they interact with other people, with society, with all kinds of other influences on their sense of well-being and illnesses. I'm working on various really interesting projects that I enjoy doing immensely. I'm a specialist in qualitative research. The JHRU Research Unit also does quantitative research, particularly surveys and evaluation of interventions. And I work with others to look in various ways with various methods at particular matters. My initial discipline is psychology, but I work with other psychologists, with anthropologists, sociologists, doctors, specialists in gender studies, people with all kinds of backgrounds, which I think brings a very interesting perspective on different topics. One topic is psychosocial aspects of female genital cosmetic surgery. And we're finding, and have found over the last few years, that there's increasing interest in female genital cosmetic surgery. So we've conducted a large national survey. We've interviewed doctors, nurses, physiotherapists, beauty therapists and other people who are intimately concerned with women's bodies. We've interviewed women who have had female genital cosmetic surgery or are contemplating it. And I have students who are looking at the discussion of female genital cosmetic surgery in social media and also analysing websites where surgeons advertise. I'm involved in projects in which we look at and interview people who have stored reproductive material before they have treatment for cancer, and we've surveyed them as well as interviewing them. Women who have stored eggs for non-medical reasons, and we're finding that they store eggs because they've not found a partner willing to commit to parenthood, rather than that they're, as so often accused of being, selfishly committed only to their careers. And perhaps one that I should mention is the way in which we now work with people who hold registries in the School of Public Health and Preventive Medicine, because when you have so much hard factual data like this, it's also very useful to see what it means to the people concerned. So we've been interviewing men who have been diagnosed with prostate cancer and also talking to GPs to see what might influence early diagnosis and the best possible treatment. I think one of the ways in which our work is important is in understanding how people experience health and illness, which means that when, for example, cures are being managed, treatments are being instituted, when the public health communications are being made, we have some understanding of how they will be received, how they could be directed to people in the community. So we see ourselves as a link between human experience and larger medical and epidemiological data, so that we see it as an entire system rather than seeing either people independently responsible for their disease or doctors and other specialists looking at disease as a separate entity away from human beings. We see it as a community, individual and medical public health link.